Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with nurse practitioner Brooke Green of Hamilton Diabetes and Endocrinology Center. Brooke, what services do you offer at Hamilton Diabetes and Endocrinology Center?
We provide multiple services, which include type 1 and type 2 and gestational diabetes education, as well as thyroid conditions with hypothyroidism, hyperthyroidism, and assessment and treatment of thyroid nodules, as well as hypoglycemia, hyperinsulinemia, metabolic syndrome.
That is great. Now, today we're going to be talking about foot care for people who have diabetes. How does diabetes affect your feet?
Diabetes, unfortunately, it can cause nerve damage over time, and this is known as diabetic neuropathy. Some of the symptoms of diabetic neuropathy would be tingling and pain, also numbness, just unusual sensations. Most oftentimes that occurs at night. For a lot of people, they'll have complaints of pain, numbness, tingling at night. And this can reduce the sensation in your feet, making it to where if you step on something, let's say you step on or have a little pebble in your shoe, you're not going to feel it like you normally would.
Right. That's exactly right. And I suffer from type 2 diabetes, and I know exactly what you're talking about.
Yes.
In fact, I recall I had a pair of shoes, and I was working on a concrete area, and I wore out the shoe, and I didn't know. And so I picked up something that cut my toe. I had no idea I cut it. And it, festered up, and I would go to the foot doctor, and they would work on it. And it turns out I had to have it amputated.
Oh, wow,
Bobby. Couldn't get any blood to it. So on my right foot, I've got 4 toes now instead of 5.
Okay.
And that has caused me balancing issues and other problems. But the tingling that you're talking about, that is pretty serious. That is some really painful stuff, and it comes and goes real strong, and then it'll just go away.
Exactly.
Yeah. Neuropathy is a very serious issue.
It is. And we check during our visits when we are assessing the individuals that we see every day. We do assess your feet. So what we're looking for are any open sores, blisters. We'll also check the sensation of your feet. At least yearly we'll do that. But we encourage everyone to look at the bottoms of their feet every day, look for anything unusual, open sores, blisters, just kind of what happened to you, Bobby. It's very important to look at those feet every single day.
Well, it is. And for you folks that have diabetes that are listening to the show today, you don't know because you have no sensation. Like I have on my feet, I can't feel my feet.
Right.
Which gives me balancing issues anyway.
Oh,
because
yes.
that's part of balancing is being able to feel your feet.
That's
so
right.
I can't feel my feet. And so when I got that cut, there was no pain.
Exactly.
And it just never, it just kept getting worse and worse and worse.
And you just didn't even realize how truly bad it was getting at that point.
Never would I have imagined that I was going to have an amputation.
Yes.
Yeah. So very scary, and it's something people really need to pay attention to.
Yes, they really do.
Is their feet, and if you have a problem with your feet. Now, what can people with diabetes do to keep their feet healthy?
Number 1, assess your feet every day. You want to make sure that when you're getting out of the shower that you dry your feet very, very well, particularly in between your toes. You want to avoid going barefoot. And most of the time when I say this, people look at me like, even in the house? Yes, even in the house. No socks either. That you don't want to just wear socks around the house, particularly when you have neuropathy. If you were to step on something, even with socks, it could go through, so you may not feel that. So I do encourage everyone to wear shoes at all times, but inspect your feet every single day. Now, if you do notice an open sore or blister, make sure you let your provider know immediately. Don't assume it's going to get better on its own. And a lot of people will base pain on whether or not they're going to see a provider for treatment.
Well, you can't do that.
Exactly, Bobby.
No.
And you had no pain
because
no pain. Of the neuropathy, the nerve damage. That's right. So please, please, please take care of those feet.
Now, what about toenails?
Toenails.
Let's talk about trimming toenails.
Yes.
Because I ran into problems with that.
Okay.
And I'm sure that a lot of people that are listening don't really know exactly how to do that if you are a diabetic.
Trimming, of course, straight across. And the key to trimming the nails is oftentimes seeing a podiatrist because it can be very difficult to trim the nails. The older we get, our nails become thick, and that's part of aging. We also tend to see thicker nails when you have diabetes. So it can be very challenging to truly take care of your nails. And I have had people to where it's been so difficult, they just haven't trimmed their nails in months and months and months. And then you can have difficulties with your shoes fitting properly, issues with ingrown toenails. I mean, the list goes on and on. So I would recommend, if you're having any issues whatsoever with trimming your nails, if you have diagnosed neuropathy, definitely see a podiatrist.
Well, I think that a podiatrist would go hand in hand with the diabetic care.
Definitely.
And I have a podiatrist I go to, and in addition to checking my feet, they also trim my nails.
Yes, yes.
And it's very comfortable and make me feel a lot better.
That's
and it looks a lot better, too.
Yes, it does. And it just makes you feel better.
Yeah. Get a foot check at every healthcare visit, even at your personal physician.
Yes, that's exactly right. It's very important. So we want to look at your feet, and we're looking also not only for signs of neuropathy, but for peripheral vascular disease where you may have decreased blood flow. And decreased blood flow, oftentimes we will see that, unfortunately, with diabetes. So if you, number one, you have nerve damage, number two, you have peripheral vascular disease, reduction of the blood flow, you're not going to have enough blood flow to get to that area that may be injured to your foot or your toe, Bobby, just like in your case. So it's not going to heal well.
Heal.
That's
yes.
right.
Yeah.
Mm-hmm.
Wow. So many bad things about diabetes.
And a lot of complications that can come with that.
There's so much to that. So many things that can happen. And now, when should people see their healthcare provider about a foot problem? If they feel like they're having a foot problem, when should they, is it okay to wait? Do they need to go today? What's going on?
Yes, immediately. So if you do see, don't wait. I have many, many, many people that have made that mistake.
Yeah, mostly men. I'm sure. I'll tell you, I'm one of them, and I know I don't like to go to the doctor, and so, you put it off, and when, in my case, it festered up so bad that I ended up losing a toe.
Yes.
Now I'm at the doctor when they open.
Right, exactly.
I don't want to lose anymore.
That's exactly right, and just paying close attention to that, and please, if you notice that, call your provider immediately so they can assess that issue right away.
Now, specific things that you should be looking for include what?
Would include any blister on your foot, any open sore, redness, swelling, anything that's unusual from your baseline. And you need to know what your baseline is. And that's why it's so important to look at your feet every day. So if you're not looking at your feet every day, you don't know what your baseline looks like.
Right.
So make sure you're assessing every day. But anything out of the ordinary, always let your provider know.
Now, I am slow to heal. And
yes.
Is that common with diabetes?
It is common with diabetes.
Is that a blood flow issue?
With the healing process, what happens, the glucose level is high in the bloodstream, and when the glucose level is high, this bacteria just thrives on those areas, on glucose. So specifically, if you have an open wound, a cut on your foot or your leg, it's going to be very difficult for your body to heal itself because of the glucose concentrated in that area. Bacteria thrives on glucose.
I got you. Now, when I hurt my hands, it's not as bad as my feet. Does it have anything to do with my heart being so far away from my feet?
Part of what causes that, now it sounds like, Bobby, you had some evidence of possible peripheral vascular disease, so you had that reduction of blood flow to that area, but also the neuropathy, the nerve damage, you're not feeling it.
Okay.
So that's where a lot of that comes from.
And a lot of people that are listening are starting to experience that.
That's
if they
right.
haven't gotten past that yet. So that's very important. What we talk about foot infections, is that common?
We do see that, unfortunately. And there again, I have had people come in the office with having foot issues for a long period of time where,
my goodness,
yes, where maybe a certain part of the toe or the foot has turned black. It's been like that for some time now. But the reason why they did not seek medical attention was because it was not painful. And you would think by looking at that it would be very painful, but it's not. But it's not, unfortunately, because of the nerve damage.
Well, that's great information. Can you tell our listeners about the classes that you guys offer?
Yes, we do offer multiple classes, Bobby. We offer insulin and administration classes, insulin pump training. We do have several people on insulin pump therapy, along with continuous glucose monitoring and blood glucose monitoring training, as well as medication management classes.
Lots of great information. Thank you for sharing all this with us today. Now, Brooke, if you could leave our listeners with one word of advice, what would that be?
That would be to assess your feet every single day.
For more information about Hamilton Diabetes and Endocrinology Center, call 706-278-1622 or visit them online at hamiltonhealth.com/diabetes. This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.